Olivia Lopez, hypovolemic shock. A 7-month-old infant is brought to the emergency department with a 16-hour history of vomiting, diarrhea, and irritability. She appears lethargic and is not moving much. Let's go see this patient. Her eyes are shut, so let's do a tap and shout. And now let's go ahead and look for normal breathing. For an infant, let's check her brachial pulse. And then we need to know about allergies. So let's ask the dad about allergies. So select medical history. Does she have any known allergies? We're going to go to our breathing tab first. We're going to put on a pulse oximeter. And while we're here, we're going to put her on some oxygen. As we can see, her sats are 91. So let's do supplementary oxygen. Let's attach a non-rebreather and let's take the flow all the way up to 15 liters. Go 15 liters. We're going to warm and humidify this oxygen. After we have our oxygen, we're going to go to circulation. We're going to put on a blood pressure cuff. We'll set up an automatic non-invasive blood pressure cuff. And we're going to attach a 3-lead. So ECG, attach the 3 leads. We can see she's tachycardic at 173. Her sats are now 92. Her blood pressure is 62/44, and she's breathing 58 times per minute. Let's auscultate her lungs. So select auscultate. Click on her lung one time. She'll listen to both sides. Let's click on her heart. Make sure she doesn't have a gallop already. Let's go ahead and do cap refill. So we think she's here for hypovolemic shock. So let's go into drugs and manage IVIO. Let's use our length-based tape so that we can get a weight. And then we need to start an IV. So let's go to manage IVIO and let's put in a PIV. Once we have our IV in, we're going to go to administer drugs and fluids, select fluids and electrolytes, and let's go find lactated ringers. Once we select our medication, we see that on our weight-based tape, 130 mils pops up, so we're going to type in 130. And we're going to administer her first fluid bolus. So during the bolus infusion, let's go finish our examination and vital signs. So select the tab that says examination and vital signs. Select the vital signs call out, and let's do a temperature. And because she's a baby, we need to check a glucose, so let's measure a glucose. All right, so again, we have her on a lot of oxygen. We're going to have our first fluid bolus is infusing. We're trying to bring her heart rate back down. If you wanted to look at other tests and diagnostics, you could select your test and diagnostics tab and see what else you could get. Our first bolus is in now, so let's go back and reassess since we did an intervention. So let's auscultate her lungs. Let's listen to her heart, make sure she doesn't have a gallop. And then we're going to push on her liver. To do that, we're going to go to head to toe examination and then press on her belly. We don't want her liver distended. Let's recheck our cap refill. So we're going to go give her another fluid bolus. We're trying to get her heart rate back down to a more normal vital sign setting for a 7-month-old. So maybe like 120. So let's go back to drugs and manage IVIO. 130 is already typed in, so we're going to select administer. So we've started a second fluid bolus for this baby. Because she's more awake, let's go ahead and sit her up. So under miscellaneous, sit up is an option. So we're going to sit the baby up. And because her sats are good at 98, let's go wean her oxygen. So back to your breathing tab. Let's go to a nasal cannula. And let's take the flow down to 2 liters. So our second fluid bolus is in now, and you can see with our second fluid bolus, our heart rate looks much better. We're in the 120s. Our sats are 98, our blood pressure 73/51, our respiratory rate's down into the 30s, so that's much better. I think she's stabilized, and we can now send her. So let's transfer patient, and let's transfer patient again. So from your debriefing, we have these blue words. So if you had gone through the scenario and you weren't sure what you were treating, you do see the diagnosis here of hypovolemic shock. If you selected that, it would take you to the ebook and you would get to read more about hypovolemic shock. Then you can also use any of the other blue words as links out into the ebook. So this is a nice debriefing. Make sure and read through your debriefing. There's a scroll. You can scroll through it to read everything that they wanted you to do right, because if you do this on your own, you may select things that aren't what they would want you to do, in which case there might be some X's over here, and then in this area you'll read what it was that you did, and then you'll see what they wanted you to do. At the bottom, you can see that we passed this scenario. Once you've read through your debriefing, then you would select continue, and it would move you forward in the program.